A casualty who is unresponsive and not breathing. This video is going to guide you through the steps to take should this ever happen to someone. It could be somebody, your loved one, a family friend, a neighbour. It could be a work colleague. It could be a complete stranger. Hopefully this video will be able to guide you to have the confidence to do something should this ever happen. When we do any assessment, we want to use the primary survey initially. You may have seen one of my previous videos explaining how to do the primary survey, but just for a short recap, I'll go through it. The letters Dr. ABC. Each letter starts the beginning of another word. So D is for danger. It's essential that you check there is no danger before you approach the person. Once it is safe, you then go into the R. R stands for response. You want to see if your casualty is able to hear you. Can they open their eyes? Can they talk to you? All we need to do is give them a gentle shake to the shoulders and shouting into their ears, like so. Bob, can you hear me? It's Sarah. Can you open your eyes? There is no response. Now at this stage, it's a natural reaction would be to shout for help, to get somebody to come and aid you. If somebody comes, that's fantastic. If you're by yourself, then we need to go onto the A, B, C quickly. A stands for airway. What do we mean airway? We've got many muscles in our body, but when somebody is completely unresponsive, every single muscle relax. Your tongue is a strong muscle. Well, actually it's 3. And when that person's unresponsive, the tongue will block the airway. So what we need to do here is to open it. We have to lift the tongue off the back of the airway. And to do that, we tilt the head all the way back. So right now, join in with me. Put your head all the way back, as if you're trying to look over the back of your head. And once you're there, try and swallow. You either can't or it's extremely difficult. Why? Because you've lifted the tongue off the airway and opened it. So let's have a look here at Bob. So to open the airway, you need to put one hand on the person's forehead. The head is really heavy. It's like the weight of a bowling ball. So you have to keep it stable. You're going to put 2 fingers under their chin and tilt the head back. Head tilt, chin lift. That lifts the tongue off, but it's absolutely essential you keep hold of the airway at this point, because if you let go, it's just going to close again. So tilt the head, lift the chin. B. B is for breathing. I want to see if my casualty is breathing. So I'm going to get my head down and I'm going to look down the tummy. I want to see, is it rising? Is it falling? Can I hear them breathing? Can I feel them breathing on my face? And it's essential we do that for 10 seconds. 4, 5, 6, 7, 8, 9, 10. If your casualty is not breathing and if you are by yourself, it's absolutely essential that you get your phone and call emergency services. Now, the good thing is nowadays that most of us have got mobile phones and we can call emergency services and put it onto hands-free and continue. If somebody else is with you, of course, they can go and call emergency services. As soon as you call 999 or 112 in Europe, we are in the continent of Europe, you will get straight through to emergency services and they will ask you, what service do you require? And you're going to say ambulance. They will put you through to the ambulance crew and they will say, is the casualty breathing? And in this case, the answer is no. They will tell you straight away to do CPR. Now, these 3 little letters, they might be small little letters, but they have a massive impact on somebody's life. C stands for cardio, another word for the heart. P is for pulmonary, as in the breathing system. and R is for resuscitation. The chance of resuscitating somebody with CPR alone is actually quite small. You're looking at maybe 5 or 6%. So why are we doing it? Well, there's 5 or 6%. The reason why we do CPR is we're going to act as the heart. And the heart pushes blood around the body, which carries oxygen. CPR is keeping all of the vital organs alive, keeping them supplied with oxygen until either emergency services arrive or an AED machine. But this person needs CPR, so I'm going to give it to them. The ideal way to do CPR on an adult is classified from the age of 18 and over. We want to use 2 hands. Now, to use these 2 hands effectively, we want to put one hand in front, the other hand on top, and we want to squeeze that bottom hand and keep those fingers sticking out. I'm going to use the heel part of my hand, and I'm going to place the heel right in the center of their nipple line, because below here is the heart. So interlocking your hands, heel of the hand right in the center of the nipple line. Now, this is absolutely essential that you keep your arms nice and straight. You don't want to be bending. Get your shoulders directly over your wrists. This isn't easy. I will say that it's not. But fortunately, you're going to have adrenaline going around your body. You'll be surprised by what you can do. Now, the number of compressions that I'm going to do is 30. Speed of these compressions, between 100 and 120 a minute, about 2 a second. The depth of these compressions, though, on an adult over 18 is between 5 or 6 centimeters. So it's with effort. So I'm going to do some compressions now, and then I'm going to describe the breaths. So interlocking our hands, heel of the hand in the center of the nipple line, and I'm going to do 30 compressions. So. 25, 26, 27, 28, 29, 30. After I've done 30 compressions, I have to get more oxygen into that person. By giving rescue breaths, puts that oxygen in so that I have something to push around the body. Now, I completely understand. If this was a family member or your best friend or one of your loved ones, you'd be quite happy to put your mouth onto theirs. But there are other things that you can use to protect you from putting your mouth on there. And that's what we call face shields. So have a look in your first aid kit at work and see if you've got one. If you don't, it might be time to purchase one and put it in. So to get the rescue breaths into our person, again, we have to open the airway, head tilt, chin lift, lifts the tongue off the back of the head. But now I have to pinch their nose closed so that the oxygen doesn't escape. It's essential that you get a good seal of your mouth around their mouth, and 2 rescue breaths. Take your mouth away and your mouth away. You've now got oxygen into the person, so we need to start pushing it around again. So exactly the same as last time. Interlocking your hands, heel of the hand, right in the center of the nipple line. Don't forget, nice straight arms. Get your shoulders over your wrist. 30 compressions. Twenty-five, 26, 27, 28, 29, 30. And then 2 more rescue breaths. Tilt the head, lift the chin, squeeze the nose so the oxygen doesn't escape. Mouth away. And you would continue doing 30 and 2, 30 and 2, 30 and 2. This is keeping the blood, which carries the oxygen around the body, keeping the vital organs alive until further help arrives. When are you going to actually stop doing CPR? Well, there's a few times. The first time, if you are physically not able to do it any longer, then of course you can't do what you can't do. However, if there's somebody else with you and they were willing to help, then they could, so you can get a rest and go between two people. The other time is when you're going to stop is when the paramedics or first responders arrive. Give them a few minutes though to get all their equipment out and ready to take over. They will ask you to continue doing the CPR until they're ready. The third time is the obvious one, when they start to breathe. And people say to me, but how do you know if they're starting to breathe? It's one of those things, trust me, you're going to know. Imagine what it's like swimming underwater, holding your breath. Now, I'm going to show you how I swim underwater. As soon as you put your head above water, you need to take in a deep breath to breathe. Now, when somebody's unresponsive, they've got zero muscle tone. You're going to see that intake of breath, that contraction of muscle. And if you see that, you stop. Just double check that that person is breathing normally. Open up that airway, get your head down, B is for breathing, check for those 10 seconds. Can you see? Can you hear? Can you feel them breathing? And if the answer is yes, fantastic. It is now essential to get them onto their side into the recovery position. Do you want to know how to do the recovery position? Then check out other videos that I have put together. My name is Sarah Phillips, owner, trainer of First Aid at Work, Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.